Professor and Chairman of the Department of Urology at the University of California at Davis School of Medicine and Comprehensive Cancer Center. Today I was privileged on behalf of the investigators for the PREVAIL trial, which is sponsored by Medivation and Astellas, to present novel data. The PREVAIL trial was a study of 1,717 men in 207 centers in 22 countries in the United States. And all these men had metastatic castration-resistant prostate cancer, but had not received chemotherapy. And the rationale for the study was it's already been shown that enzalutamide improves radiographic, progression-free survival, and overall survival in men who had chemotherapy. And the question is, would they benefit prior to chemotherapy by receiving enzalutamide? So the study did show, in fact, exactly that. There were three critical elements that we found in this study. One is that there was an 81% relative risk reduction in the enzalutamide group compared to the placebo group with regard to radiographic progression-free survival. There was also a 29% relative risk reduction for men with enzalutamide compared to placebo with regard to overall survival. And there was a 65% relative risk reduction for the enzalutamide-treated patients compared to placebo with regard to the time at which chemotherapy would be initiated, and that's a sign of disease progression. So in this study, what we also focused on was breaking the patients down into those who had metastases that were visceral versus non-visceral. Visceral metastases means patients who have cancer that is spread to either the lymph node or lung, and non-visceral other sites. And it looks as though, compared to the entire group, those who had non-visceral metastases were almost identical with regard to the three outcomes I just mentioned. But the visceral, despite having worse disease characteristics, also had significant benefit. So this is important because the PREVAIL trial is really one of the first trials that includes men with visceral metastases who are getting treated before getting chemotherapy with an oral agent or another non-chemotherapeutic regimen. So that's what makes this trial extremely novel, important for both urologists and medical oncologists.